tell you a thing or two about asthma. Asthma is caused by inflammation of the small airways of the lungs. It can be triggered by cold air, exercise, smoking, and so much more, causing shortness of breath, a cough, and even wheezing. Asthma can be diagnosed if somebody has the typical symptoms along with an assessment of how much air you can blow out quickly. Most people are often given inhalers at first and more medication if it doesn't get better. A reliever inhaler eases symptoms when they come on, whilst a preventer inhaler is used every day to prevent symptoms, even on a good day. Comment down below what we should break down next, and remember, COPD is one of the leading causes of death in the world. COPD, or chronic obstructive pulmonary disease, is a long-term condition of the lungs where airflow is restricted. Smoking is by far the biggest cause, leading to damage and long-term inflammation that cannot be reversed. A cough is usually the first symptom to develop, followed by breathlessness, wheeze, phlegm, and regular chest infections. COPD can be suspected by a doctor if it sounds like a typical case. Spirometry tests are used to confirm it, which assess how much air you can hold in your lungs and how fast you can blow it out. The first thing someone with COPD should do is quit smoking. Inhalers and tablets might be given, but if it gets really bad, they might be connected to an oxygen tank for life. Let us know in the comments below what we should cover next, and remember, somebody with COVID-19 might have a pneumonia, but not every pneumonia is caused by COVID. A pneumonia is an inflammation of the lungs, usually because of a chest infection. This can be caused by a bacteria or a virus, or even food or saliva going down into the lungs, which is called an aspiration pneumonia. Pneumonias are more common in smokers and people with weakened immune systems, like the elderly. This can cause symptoms of a cough, bringing up phlegm, shortness of breath, and even a fever. A doctor can listen to the lungs using a stethoscope, often hearing crackling noises if there's a pneumonia. Blood tests can be used to pick up signs of an infection, and an X-ray of the chest used to confirm the diagnosis. Most people recover with fluid, rest, and antibiotics that kill the bacteria, if there are any. But if it gets much worse, then they might be admitted to a hospital for oxygen and stronger antibiotics given via the veins. Comment down below what you'd like to learn next, and remember, have you ever seen one of those movies where the bad guy starts coughing up blood until he dies? Well, it's not a joke. Coughing up blood in medical terms is called Haemoptysis. Haemoptysis can be caused by a wide range of problems, but it's important to go and see a doctor as soon as possible because it could be something serious. It might get better on its own, for example with a simple chest infection, but it could also be something more sinister like lung cancer or a blood clot in the lungs. It might also come along with other symptoms like shortness of breath, fever, chest pain, and coughing up phlegm. Some blood tests along with basic imaging can be performed at a hospital, like an X-ray of the chest, a CT scan, or even a camera test that goes down into the windpipe called a bronchoscopy. The treatment here really depends on the cause. It might resolve shortly after a bit of medical treatment, but it could also be here to stay. Most importantly, seek urgent medical attention if you see it. Tell us what to break down next, and around 50,000 people in the UK are diagnosed with lung cancer every single year. Primary lung cancer is a lung cancer that originates in the lungs. It mainly affects older people, so it is rare in people under the age of 40. And by far the most common cause is smoking. So make sure to put that cigarette down. The symptoms of lung cancer usually develop slowly over time, including shortness of breath, tiredness, cough, and weight loss. An X-ray of the chest and CT scan might then be used to confirm the diagnosis. And in order to understand the exact nature of the cancer to treat it best, they might use an ultrasound to guide a flexible tube down into the windpipe and then pluck a small part of the cancer off in order to look at it in a lab. Treatment usually includes some combination of the following: surgery to cut out the cancerous bit, radiotherapy where radiation is blasted at the cancer cells in order to make them shrink, and chemotherapy which helps do the same. Comment below what you'd like to learn about next, and remember,